page?
Let me check.
Go on Facebook and see if I'm on Dr. Myla. You know, hand me my other phone out of my purse. Purse. Yeah. Thank you. Hello, 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 Facebook. I hope I'm on the right page.
Mm-hmm.
I am Dr. Myla Bennett?
Mm-hmm.
Okay, perfect. I am on the right page. I'm Dr. Myla Bennett of Adirabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. And this is a follow-up video to some of the comments that has come up from the video I did last night that I feel like are part of the problem. So I'm going to give people a few seconds to come on, and then we'll kind of dive into this topic. It's going to be quick because it's in the middle of my day, and I only got like a 20-minute break, so I got somebody that'll be here in 20 minutes. So share the video and let people know that I'm on it. Since the post last night, I spoke with the sister of the other woman who died this weekend. She died in Tijuana. It's just kind of ridiculous, like, you know, the amount of women who are losing their lives for surgery. And this mother was a mother of 4. So her children were young, ages 4 to 10. The 4-year-old will probably barely have memories of her mom. It's just not good. But anyway, most of the people who made comments that I was actually able to see on the video were appropriately prayerful and sorry for the family of Alicia Williams, who lost her life in the Dominican Republic this weekend. But then there were some people that I just really think they completely lost the whole point. And I feel like the things that people were saying, like talking about shapes of bodies and doctors in the DR make better body shapes and nobody wants to look like SpongeBob and blah, 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 blah. That's not even the point, because looking like a video vixen, whether you look like a video vixen or SpongeBob, is irrelevant if you're in a casket. It doesn't matter, number one. And number two, the assumption is that everyone wants to look like that, which is wrong, because everybody doesn't want to look like that. And everyone doesn't want to help create that, which is part of why I don't do that kind of work. I'm capable. I choose not to. I focus on natural appearing enhancements. I focus on things that help a person look like their best self, not look like somebody else. And so the women who are attracted to my work want to maintain their essence with surgery. They don't want to turn into a completely different person, which is fine. And the people who want to do that, to each her own, and find a surgeon that is safe, that won't kill you, to help you reach the goals that you want. But to sit on there and call a woman SpongeBob who doesn't have the goal of having a shape that's not her normal one, that's completely inappropriate and unfair, and part of the reason why people are dying. I see people say that all the time. First of all, some of the people that they're saying look like SpongeBob are like normal women. So now a woman's natural form is SpongeBob. The natural form of most women is that of SpongeBob. That's not right. Like, that doesn't even make any sense. So now our goal is for every woman to look like an unnatural version of what women tend to look like, because the bodies that, you know, people are going to these places, supposedly going to these places so that they can get this shape. That's not how anybody comes out. Like, no one is born with and grows naturally into a woman with bodies like that. Every blue moon you'll get somebody whose body is naturally shaped like that, but for the most part, that's not how like 90% of women are shaped. So the argument I'm supposing is that if you're going to spend money on plastic surgery, you should only spend money on plastic surgery that makes you look like somebody else. I argue that if your goal is to look like somebody else, you shouldn't be getting plastic surgery. You should be getting a therapist. Because if you are so unhappy with the way you naturally are, that's a major issue. So the women that come to me, their goals tend to be ones that just get them back to where they were before. So like, especially with like tummy tucks and stuff, they'll be trying to get back to the shape and the body they had before they had babies. Well, if they probably weren't built like a video vixen before baby, so that's not what they're aspiring to do now. Everybody doesn't want that, and that's fine. The people who want it, have at it. All I want is for you not to die getting it. That's it. I could care less. I don't want you people, the folks making those crazy comments. My thing, when somebody said you need to go to the Dominican Republic and get them to teach you how to do surgery so your patients don't look like SpongeBob, and then maybe more people will come to you. If the people that are coming to me are you, no thanks. I'll make SpongeBobs all day to keep that venom out of my office. The assumption is that I want everybody to come to my office, and that couldn't be further from the truth. I don't want that bad energy in my office. I don't want people with unrealistic expectations in my office. I don't want people peer pressuring me to kill them in my office. I don't want it. I want normal women who have normal mental health to come in here, and I will help them be their best selves, help them feel confident, help them get back to where they were before they had children. That's it. To each her own. If that's what you want to look like, fine. But don't shame the women who are happy with themselves, happy with their shape, happy with their natural appearing curves. Don't go and bash them. Don't do that. And when someone said, well, somebody said, nobody's gonna pay $20,000 to be botched or something like that. As if not making someone look like a caricature is botching them. I mean, I argue that perhaps the people who get surgery to look like a caricature, they're the ones that are botched. So you're putting your life on the line to be botched. Like, that's relative. So just don't offend. If you don't like it, don't get it. If you don't like what I have to say, get off the video. It's really that simple. You're sitting on my video arguing with people, trying to hurl insults at me. I don't even know who you are. And I hope I never know who you are. You're doing all of this stuff. If you don't like it, just get off the video. If you want to go somewhere and put your life in danger, have at it. Go do it. That's all I can say. But don't offend the women who are confident and who are happy with the way their bodies are naturally shaped. That's not fair. Right. Everyone doesn't want to be like that. So that's all I wanted to say to that. Stop body shaming other women. And if you want to put your life at risk to get cheap surgery to look like something that's not real, go ahead. But don't like insult the people who are happy with the way God naturally shaped them, because the woman's form is beautiful in all the forms that it comes in. So that's that. That's all I had to say. So y'all can share this video so those people can see it. Well, actually, some of those people who said that stuff won't be able to see it because I blocked them, so they still won't get to see the video. Maybe they'll see it I don't know how they'll see it, but maybe they can see it on YouTube. I'll put it on there. Let me see if I missed any questions, because that's really all I have to say about that. Yep, they pay more than that and die. I just couldn't believe that that's the stuff people were saying when we were talking about a woman who lost her life. Talking about a son who lost his mother. And then the response was, well, if she went there because she didn't want to look like SpongeBob. Okay, so she don't look like SpongeBob, but she's dead. Like, and what about the women who their families can't afford to get them back, so they have to get cremated? So nobody even gets to see it even in a casket because they can't afford to get the body back. Like, this stuff is way more serious than the shape of somebody's body. And here's the other thing. The person who was talking about the price, you're right. You may not want to spend $20,000 to get your whole body overhauled. Literally, like getting your whole body redone, and it's not worth 20 grand. If you're not worth 20 grand now, I mean, that's fine, to each her own. I know that I'm worth way more than $20,000. I'm certainly worth more than $5,000. But I argue that if you can't afford to do it safely, then just don't do it. Don't do it. You don't have to get anything if you can't get it safely. If you're saying, well, I'm just willing, I mean, it's a risk of surgery. It's not a normal risk of surgery with an ethical doctor. It's not. And somebody said, so you're saying there's no good doctors anywhere else but in the US? I never said that, ever. If you watch any of my other videos, I've said a million times, there's great doctors all over the world, and there's bad doctors all over the world. There's good doctors in the US, there's really bad doctors in the US. There's probably some good surgeons in the Dominican Republic, I'm sure of it. The problem with the Dominican Republic right now is all the, not the unethical doctors, but the problem is the unethical ones that are running plastic surgery factories and rolling women out like they're cattle. And the major issue is the infection risk that comes in the Dominican Republic. I'm literally in a group full of women with hideous infections that they've been fighting, some of them for over a year, and it's still there. They still have it. That they've been fighting, getting multiple debridements, and their body's basically just getting chopped all up, and they're on these heavy antibiotics that make you very sick trying to clear it, and the infection won't clear. Why would you go there if you know that that's what people are getting? It's not. It's a public safety issue right now, and it's a health hazard. And when women come back with those super resistant bacteria, and then it's bringing it here and making patients here more at risk for getting it, because we're bringing those things back. Like, it's just not a good thing to go there for surgery right now. I'm not saying ever, but right now the facts are the facts. So my thing is, if you can't afford to get it, or if somebody can't do it to your liking in a safe environment, just don't get it. Keep the body you got. That's what I think is logical. I wouldn't knowingly lay down with someone who has had several people die. One of the other lady who died this weekend, her sister told me that her surgery didn't happen till 1 a.m. Now, I've operated in the middle of the night before, but not since I've been doing aesthetic surgery. That was when I did reconstruction. And, if I was operating at 1 a.m, it was because the surgery, it started at a normal hour, or it was an emergency that we were taking back. But to plan to start an elective procedure, a cosmetic case at 1 a.m. because you've been operating on 100 other people all day long, that's just no good. Surgeon's not rested. The team is probably not rested. Like, it's just odd. But that's because people are having people treating them like cattle. But they're not cattle, they're women. Somebody put on the thing, how is it that 15 people can be sitting in the waiting room supposed to get surgery at the same time? Like, how is that? I can't do 15 surgeries in one day. Like, not those big surgeries. If it's some little surgeries that take 30 minutes, okay. But these are big mommy makeover overhauls, and they're doing 15 of them in a day. That's why they have to do a lot, because they're charging you not enough. So now the quality of care is going to go down. All those things you have to consider. That's not good. That's not a good thing. I would never lay down for an elective surgery at 1 a.m. after my surgeon's been operating since 6 or 7 in the morning. I'd be like, can we reschedule? That's what I would say. And that lady whose surgery started at 1 a.m, she died. Think about it. Instead of attacking me, let's think about what the real issues are. I didn't do it. All I'm doing is trying to keep people from getting hurt. I didn't do it. I didn't do that. I'm looking at the comments. Right, people, they'll say that, well, the prices are too expensive. Okay, so you're not hurting me. Like, the lady who died, it didn't hurt me that she went somewhere else. You're hurting yourself. So when you say, well, because somebody said that, well, if the U.S. doctors would lower their prices, I don't have to lower my prices to keep you from killing yourself. That ain't got nothing to do with me. That's your choice. I don't have to do that. I spent a lot of money and time to educate myself. I have overhead. You see my office? This is a nice office. I have staff. Say hi, staff.
Hi.
Right? All these ladies want paychecks. I can't do your surgery for $5 so that you don't die. If you can't afford surgery, don't get it. I'm not lowering my prices so that you decide your life is worth it. That doesn't even make any sense. That makes no freaking sense. I'm not lowering my prices. I'm not doing free consults. I'm not doing any of that stuff so that you feel like I'm good enough. Don't come here. You don't have to come here. I said on the other video, this is not a commercial for my practice. This is a plea for your life. That's what it is. So you're not hurting my feelings because you went somewhere else. You're just putting your own self in danger. Exactly. I said that too. Crystal and I said, why would you want to go anywhere to have surgery where you can't use the water? That's like basic, seems to me like basic common sense, but apparently it's not. Because that could be, I mean, if you can't even take a shower because you have surgical incisions and stuff and it's not safe to do that, that's kind of an issue. Like, but I thought that was obvious, but apparently everybody else doesn't. This is why we're having these issues. Right. What people understand is that the doctor in the U.S. don't have to touch them after they go over there. You're right. We don't. And I don't. Like, I don't. You have to be out of your immediate post-op period to be seen in my office. The only way I'll see a person that's in the immediate post-op period from surgery, from any surgeon, it doesn't matter what country they're from, is if it's a courtesy to a colleague who calls me and is like, hey, I have this going on. I have a patient that's there. Can you see him? And for a courtesy to one of my colleagues, absolutely, I'll see him at no charge. For one of my colleagues. My colleagues, they do it for me too. That's the beauty of, being connected to someone ethical who has friends all over the country. Yeah, it is. It's the people who can't afford it. And they'll sit on here and say that they can and they just don't want to look like SpongeBob. And I'm just like, look, the women who I service, they don't look like SpongeBob. They look like beautiful women with natural appearing shapes. That's what they look like. Dr. Camille Cash, Candace, she's great, and I love her work. I'm just reading the comments, y'all, before I get off. Is it normal to be wheeled out of recovery 15 minutes, 30 minutes after having a tummy tuck? People are in recovery for different amounts of time. It depends on, everybody wakes up different, and people, are ready to be out of the recovery areas at different times. Everybody's bodies process anesthesia differently. So there's no amount of time that's right or wrong. What you think? She just put a sign up asking me that I want a smoothie. First of all, smoothie ain't keto. And a keto smoothie is probably gross. And I don't do smoothies. I like to chew. Do they have something I can chew there?
Yeah, they got good food. It's not like it's keto friendly.
Yeah, don't worry about it. I need to be keto. All right. School, many years getting education, people's lives in their hands. Of course, they need to charge more. Your life is in their hands. Exactly. And surgical equipment is expensive, and supplies are expensive, and appropriate personnel is expensive. When you have the tech doing your surgery, the person who doesn't even have a 4-year degree doing the patient surgery, then you can make it cheap because they don't cost that much. I mean, it's just like lots of things that you should probably think about. Why is it so much cheaper? You should be thinking about that. And not trying to cut corners with the one and only body and life that you have. My patient might have just walked in. I'm gonna have to get off. You sure don't, Melissa. You sure don't look like SpongeBob, boo. I'm in Johns Creek, Georgia. It's a suburb of Atlanta. Thank you. All right, so I made it to the end. So I'm gonna go ahead and sign off because my patient just walked in the door anyway. But I just wanted to address the whole SpongeBob crap because I'm just kind of tired of seeing it, and I'm tired of, because the thing is when people put, you're gonna write, she looks like SpongeBob on the bottom of one of my before and after pictures because you're trying to be a jerk to me. Who you're hurting is the patient who follows me also and reads that comment. So now you just made her feel a way about her body. Like, if you want to take digs at me, DM me and say something rude to me, but don't say it on the bottom or put it on the bottom of one of these videos. But like putting some evil crap on the bottom of one of my patients' posts, that's how you get blocked. I'm not gonna watch you like berate my patients. Not gonna do it because you have mental problems. So that's how you get blocked from my page. So I advise you to figure out another way to let out your anger and frustration toward me. Hey, Bennett. All right, y'all, I'm gonna go ahead on and sign off. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.adarabella.com, or you can call my office at 678-325-0006. All right, bye, Bennett. Bye, everybody.